Hello, my name is Jaylene Lee. I'm going to be the primary supervisor for the Outpatient Polytrauma TBI Clinic and Strategic Alliance for Brain Injury Rehabilitation and Recovery Clinic. I'm glad that you're able to watch this video today to learn more about this rotation. Just a little bit about myself. So I am a rehabilitation psychologist and I was actually trained here. I did a 2-year postdoc at this VA in rehabilitation psychology. The secondary supervisor for this rotation is going to be Dr. Vega, and you will likely have an opportunity to meet her during the open house, but she is unable to do this presentation today. So really I want to start out by talking about the patient population and presenting concerns of the individuals that we're working with. So in the Strategic Alliance of Brain Injury and Recovery Clinic, so the SABIRR clinic, which I'm the primary psychologist for, we see mostly active duty service members and special operations and conventional military. So I see a lot of individuals who have worked within Special Operations Command or are special operators like Navy SEALs, Green Berets, and a lot of individuals who are in the transition period into retirement or are recently retired. A lot of the service members that we work with are married or divorced and they have children. We also work with veterans as well in this clinic. We see both male and female veterans. We do have females that come to this clinic. And generally the age range is anywhere from 20 to 60. We might have people a little bit older than that, but this is our typical age range and probably the average in the 40s. Generally, these individuals are very highly motivated for treatment. They want to get better, they want to improve, they come to their appointments and they're really fun to engage with. So some of the commonly reported history and presenting concerns include things such as traumatic brain injuries, blast exposures, multiple combat exposures, and I forgot to say the traumatic brain injuries can range anything from mild, moderate to severe, but most of the time we do see mild or concussions. These individuals oftentimes have anger control problems or frustrations related to anger. They have mood symptoms like trauma-related symptoms, depression, anxiety, might be experiencing things such as substance abuse to manage or cope with their stressors. They might be having difficulties in relationships or in family situations. They often have transition concerns related to the unknowns of the future and upcoming retirement, adjustment concerns related to emotional adjusting to disability or changes in physical functioning. A lot of them have vestibular dysfunction or dizziness and nausea, cognitive functioning complaints, vision problems, hearing problems or tinnitus, chronic pain, orthopedic pain, headaches, sleep disturbance, and sleep apnea. So these are just things that we commonly see in our clinic. When we talk about intern activities, the first thing is we really want you to learn about this population and function as part of our outpatient multidisciplinary rehabilitation teams. So we want you to be actively involved with consultation with our other disciplines. Our teams include nursing, social work, physical therapy, speech pathology, physiatry, psychiatry, audiology, ophthalmology, occupational therapy, and vocational rehab. So we have a lot of different team members that we interact with on a day-to-day basis to try to help manage these symptoms or help improve the symptoms. Another intern responsibility is to conduct comprehensive psychodiagnostic assessments incorporating evidence-based measures such as the CAPS, PCL-5, Diener's Satisfaction with Life Survey, and at times, if appropriate, we might also throw in things like the Personality Assessment Inventory or the MMPI-2. So we're really flexible depending on what is necessary and what's needed. We might add additional measures as appropriate. This rotation really allows a lot of opportunity to develop and demonstrate your differential diagnostic skills and really improve your confidence as a clinician as far as diagnosis and treatment. That's the other piece, is we want to really help engage with creating a nice treatment planning environment where you can learn how to integrate the education regarding TBI recovery trajectory, what the patient should really expect from cognitive related to cognitive complaints, and think about comorbid behavioral health factors, like how does sleep play a role into cognitive functioning and mood. We're going to talk about that and explore that. We'll also talk about other factors related to the specialty population. Like I mentioned, there's a lot of transitional concerns, and so that's something that we do talk about and do think about holistically within this holistic picture of the individual. Within all of that, once you do the treatment planning, we want you to really be able to hone in the skills of selecting and implementing appropriate evidence-based interventions. So what you tell the patient might be helpful. We want you to be able to figure out what's going to be most helpful, and then also figure out how to tailor that to the patient's needs, their desired goals, their presenting conditions, basically their unique characteristics and diversity factors. And within that, also involve them in that treatment planning process to figure out what's most appropriate for them at this time and what they feel most connected to. So the treatments that we do trauma-focused treatment such as cognitive processing therapy, prolonged exposure therapy. We are supportive of individuals who are participating in CPT consultation, as Dr. Vega is a CPT consultant. Other intervention opportunities that we might have you participate in are things like working on facilitating emotional adjustment to injury or disability or transition. This is a really critical time period for individuals when they're transitioning from active duty to civilian life, not only for mood symptoms to pop up, but also for things like suicide or suicidal ideation. And so it's a really important topic to talk about and bring to light. So that's an opportunity here. Also doing things like motivational interviewing, different types of cognitive behavioral therapy for depression, chronic pain, insomnia, doing some dialectical behavior therapy. So those are all opportunities that could potentially be tapped into in this rotation based off of individual patient needs and characteristics. Really the goal, and when we work with patients, is to flexibly deliver and adapt evidence-based treatments to enhance outcomes with these populations based off of, if they do have a TBI or if they do have other things going on, really figuring out how to best serve the needs of the individuals we're working with. Interns will also participate in 2 hours of one-to-one supervision a week. Of course, we want you to be active participants where you're really helping guide what we're talking about, but also figuring out what you want to do as far as improving yourself and trying to meet your needs within within what we can do in this rotation. A couple additional opportunities that may be available are things like increasing your knowledge about military culture, special operations culture, and working with active duty service members. So we work a lot with active duty service members and special operations, and so this is a really good way to hone additional understanding of military culture and the different cultural subsets within that. You can learn about rehabilitation psychology competencies and practice them if that's something that you're interested in, and participate in rehab psychology seminar if that's something you're interested in. If you are interested in rehab at all, I would definitely recommend and support being involved in that seminar. There might be opportunities to engage in journal club with topics related to our population. For example, blast injury is something that more and more researchers continue to come out on, but we still don't know a lot about. And so finding journals, articles to discuss can be something we could do as well. And then the last thing, there might be opportunities to engage in brief cognitive assessment or use cases from this clinic for comprehensive assessments as available or as appropriate, and definitely would be having a conversation with your assessment supervisor to determine the appropriateness. So I just want to thank you for taking interest in the James A. Haley Veterans Hospital internship program, and thank you for being interested in this rotation and listening to this video. I wish you luck in this process of finding an internship.